For light moving touch technique, all you need to have is your fingertips, or you can also use a camel hair brush. The selection of dermatom will depend upon which muscle you want to activate. You can do light moving touch for 3 until 5 repetitions and take a break for 30 seconds. And during that time, you need to give some activity to the patient. For fast brushing technique, all you need to have is a rotatory hair brush, which is easily available, or you can also use a brush which has thick strand. Apply the brush in a similar fashion over those dermatomes. One important thing about this technique is that if you use fast brushing, it will not only activate the muscle, but it will also help to improve the sensory function. For the next technique is icing, or it also called as quick icing. And you have to apply it on the target muscle over the overlying skin for 3 quick swipes. You have to immediately wipe the water using a handkerchief after the swipe. For using this technique, put your patient in the desired developmental pattern sequence, and then give approximation to the desired joint either manually or using weight cup or sandbags. This technique can stimulate the joint proprioceptor, and this in turn helps in improving the tone of the stabilizing muscle of that joint. To perform this technique, all you need to do is ask the patient to do a movement. You let the movement happen for some time. So what you are actually doing is the intention is to contract. So what is going to happen is that the next contraction or the next effort of the patient, that will be even more powerful, because now the patient has a feedback that he needs to improve that effort from his muscle. Resistance not only improves the muscle strength of the patient, but also motivate the patient to work harder. When you start resisting a contraction of weak muscle, then that muscle goes into shortening. When the muscle goes into shortening, the spindle of the muscle also shortens relatively. And when you stretch a muscle spindle, that is shortened. In this subcomponent technique, you have to apply 3 to 5 quick repetitions of tapping over the dermatom overlying the muscle that you want to activate. You have to apply 3 to 5 quick repetitions of tapping over the dermatom overlying the muscle that you want to activate. You use a particular function, and when the patient is doing that activity, you give a quick tap over the muscle that you want to facilitate. The third subcomponent is vestibular stimulation. For this technique, you can move patient head for up and down movement or sideway movement. This technique can activate the anti-gravity muscle even before the stretch reflex. In this side, patient is rolled slowly from supine lying position to front and back in rhythmical pattern. It is used on both sides of the body, and this technique also result in general relaxation and decrease in the abnormal tone. The next inhibitory technique is called as tenderness pressure or tendinous pressure. In this technique, the therapist applies manual pressure over the tendinous insertion of the muscle. Maintenance stretch can also be used to significantly alter or reduce the muscle tone in a spastic limb. This will lead to a lengthening in the muscle spindle, which will result to a newer length and will become less sensitive to stretch. For the next inhibitory techniques recommended by Rood is called as rocking. In this technique, the patient is positioned in a weight-bearing position, and the weight is shifted in different directions, like forward and backward sideways. And in a diagonal patterns, you must have seen how a mother calms her baby by gentle rocking, and the baby goes to sleep.